Hi everyone, and thanks for joining today's webinar on provider recruitment and retention. My name is Danielle Garrett, and I'm the Director of Primary Care at the Association of State and Territorial Health Officials. I'm also joined today by my colleague Chantel Dixon, Senior Analyst for Primary Care at ASTHO. Part of our job at ASTHO is to provide support for primary care office directors and staff through activities funded by a cooperative agreement with the Health Resources and Services Administration. So those activities include things like the Mentor Program, which many of you might be familiar with or currently or in the past have participated in, and today's webinar. So today's webinar on provider recruitment and retention is the first in a series of webinars that are meant to provide a space for PCO directors and staff to come together to learn from one another and to provide a forum for open discussion and sharing of best practices. The topics of these webinars were chosen based on a TA needs survey that we conducted last year of PCO directors. And some future webinar topics this year will include behavioral health integration and patient-centered medical homes. So look out for invitations to those webinars in the coming weeks. I hope you're all going to feel free to engage in an open dialogue with one another today and with our speakers at the end of the webinar. So in order to encourage an open dialogue during today's webinar, everyone's phone lines are currently open. So I just ask that if you're not speaking, you please mute your line to cut down on background noise. And then you can unmute your own line if you have a question or want to engage in discussion at the end. But just to make sure we don't have too much background noise, I'm going to ask for everyone to mute their phone lines. Thanks. So today's webinar on provider recruitment and retention features two speakers. We're going to start out with an introduction from Mike Shimmens, the Executive Director of 3RNet. And then we're going to move into a presentation from Tom Rauner, the Primary Care Office Director in Nebraska. Tom's been with the Department of Health and Human Services for 32 years and the Primary Care Office Director for 18 of those years. He's been a member of 3RNet since it was created and enjoys the sharing collaborative nature of its members. And Tom works with a number of programs involving the preparation and placement of healthcare providers in federal and state underserved areas. These programs include the National Health Service Corps, the National Rural Recruitment and Retention Network, and the Nebraska Office of Rural Health Incentive Programs. He was involved with creating the Health Professions Tracking System in Nebraska, which continuously monitors the practice locations of physicians, nurse practitioners, physician's assistants, behavioral health providers, and dentists. He enjoys addressing healthcare workforce and health policy issues. So we're going to hear from Tom in a minute, but now I'm going to go ahead and hand it over to Mike. So Mike, go ahead and kick things off for us.
Okay. I greatly appreciate it, Danielle. Can you hear me okay?
Yep, sounds great.
Okay. Thank you. Yeah, I'm calling in from a cell phone today, so I appreciate everybody's time and the opportunity to talk to this great group. Many of you know 3RNet, some of you better than others. Some of you are actually probably members of 3RNet like Tom is. Some of you probably work closely with 3RNet, maybe through your state office of rural health or perhaps your PCA or some other relationship you have in your state. And some of you may be new and have not heard of 3RNet. So let me give you just kind of a brief background on 3RNet and kind of our purpose in working with and how we work in retention and also how we work with the project Tom Rauner is going to speak about here in a few minutes. So first of all, 3RNet, or the National Recruitment and Retention Network, is an organization that's been around now over 20 years. As you can hear from our name, we have retention right in our title. But most people know us probably best for a recruiting job board, which we've run since the very beginning in 1995. That is kind of our main tool for getting jobs from underserved and rural areas out there and also making matches. And some of our states are very active in that process and some are not maybe as active, but yet still use the service and make it available. In the retention part of our name, we have kind of had different associations and different ways we go about this. I think probably one of the biggest things we've done is from the very beginning, there was a product that went kind of hand in hand with 3RNet, developed with the Robert Wood Johnson's grant, and this was back in the mid-90s, called Practice Sites. And again, Tom will fill you in on the rest of it, but basically when Practice Sites was developed in the state of North Carolina with this Robert Wood Johnson's money, it was basically interacted with 3RNet members, and they could use this product and this community development tool to track the process, recruitment process especially, their jobs, candidates, matches that they made, a very slick process, but a server-based product at that time. In addition, about 5 or 6 years after that, in the early 2000s, a group of our members got together and put together a manual kind of a 15-step process that we actually call the Recruiting for Retention Manual. And it is really an effort to kind of show the facilities that you may work with, critical access hospitals, rural health clinics, FQHCs, basically how a process may work to walk you through to get to that good hire, that hire that may be retained. So that is another effort that we've been involved with for a long time when it comes to retention. Speed ahead just a little bit. In the late 2000s with the ARA money, and probably around 2010, 2011, Tom will give you some more probably direct numbers on that, but Practice Sites was, as a recruiting system, having some problems because of the web-based nature of it, the server-based nature of it. And also there was some dollars put together to create and from some of the states about a retention process. So the multi-state and retention collaborative came together. Again, Tom will speak more about that. At the same time, though, our recruiting side of things was kind of getting antiquated, and there was an effort made to try to see if we could replace it with a web-based version. So a couple things that happened simultaneously. When the multi-state collaborative came on board, again, some of you are participating with that with Nebraska and other states, there was enough money pooled together, and using some dollars from the North Carolina Foundation, now the Foundation for Health Leadership, they were able to use some dollars combined with the state's contributions and put together a retention system based on the Practice Sites model, which again Tom's going to go through. But what that left is a recruiting side of things that was antiquated and on a server model stationed in a state. That system was not able to get upgraded, so where we are right now today, so the latest update is we have now transitioned those states that were still using Practice Sites as a recruitment model. They are in the process or have went ahead and transitioned to a new model. Actually, it's a commercial product called Contact Intelligence, and that system is going to be integrated with the 3RNet so that the two systems will talk to each other and share information similarly to what Practice Sites did before. So we are very excited about this opportunity because it's going to be a great enhancement. We'll have a web-based tool to connect with 3RNet, and then we will also be able to, especially our members that are working with both products, will be able to track and do a lot of additional work with candidates and things that they're working on. So, and then in addition to that, then again, Tom's going to kind of run through here in greater detail what the Practice Sites then retention system is all about, how that works. And again, states that are using all of these products, we're definitely going to keep working toward a further integration with these products so that we can make this as seamless as possible for our users. So if you are the State Office of Rural Health and happen to have also the PCO and also are the 3RNet member, we're going to try to make a kind of a seamless transition between these. So we certainly are working toward that and appreciate the work of all involved. Tom has done a great deal of work on this program for the past, 4, 5, 6 years to try to make this work. And I think you can see his vision coming together with it, as well as the addition of Dr. Don Passman and the work of the Health Foundation in North Carolina. So Tom is, as you heard in his intro, a longtime member of 3RNet, actually one of the original members. Been on the board a couple times, and he currently is on the board again, and he's president-elect. This September he will take over as president of our organization. So he is my boss, and I appreciate all the work he's going to do in presenting what is the Practice Sites Retention Collaborative and how this is a great product that a PCO can use to track your programs. And we are very excited about it. And again, it's a continuation of kind of the 3RNet's interest as well. We are involved with the leadership group of this particular product and greatly enjoy that opportunity. So with that said, I'm going to turn this over to Tom to kind of walk through more of the dynamics of this, and hope you have a good presentation here. And again, appreciate the opportunity to be here and kind of introduce where we are at this point. So Tom, you can take it from here.
Okay, thanks, Mike. Again, if people have some questions, feel free to go ahead and jump in. again, I assume you can hear me out there. Is that right?
Yep, sounds
Okay,
good.
great. Just wanted to double check. So what I'm going to do is I'm going to try and go over the retention collaborative activities that we've been doing since about 2012 and give you a little bit of an update. I guess, this started out as American Recovery and Reinvestment Act retention collaborative, and it's kind of moved into something where we're going ahead and focusing not just on National Health Service Corps, but also various state programs as well. And if you want, go ahead and go to the next slide here. And so what I want to do is I'm going to just kind of quickly walk through what we've kind of done, some of the lessons learned, what we're doing, and kind of where we're continuing to move forward to and go. This retention collaborative is an ongoing venture that's between the, started off basically with the University of North Carolina SHEP Center, Dr. Don Pathman, who has great experience, 20 plus years in doing retention studies with National Health Service Corps and other providers, as well as the Foundation for Health Leadership and Innovation, which is something that, like I said, that was earlier mentioned here with Mike, as far as having the practice sites recruitment software. And we've now added the retention management software to that, and they're kind of going through the process of phasing out, as he mentioned, the recruitment software component of that. So next slide here, I'm just going to kind of give you, like I said, brief going over of this. And so the first year that we went ahead and did this, we just designed and fielded this one-time retention-focused survey, created some baseline information from that, and then we were able to go ahead and put this together. If you can, just make sure you have your line muted, just so we can kind of hear this. The other piece, I guess, on here is that we went ahead and in year 2 began going ahead and creating this practice sites retention management system software. So from that, we were able to go ahead and build basically something that we had kind of learned as far as trying to make something that was cloud-based, as far as a survey tool that really needed to be built, and then generating some data from that to help programs. Next slide. Let me see. That's not the slide I have, so go ahead. Oh, go one more slide. Sorry, I was going to skip that one. I just kind of wanted to show you the states that were participating in this. A couple of the states have dropped out. We had some changes in the people who were members within those states, and they didn't want to continue, and I think that's something we learned from the collaborative. We also had a couple of other states go ahead and join us as well in the second year of this. So it's something that it kind of continues to evolve, but as I will mention to you here, I think from where we're at now, we went ahead and built this online web-based software, which is cloud-based. It's really much easier to go ahead and use and access, and is really moving us forward. And so if you go to the next slide, you'll see that we've gone ahead and added several other states to this. One of the things that, again, we've kind of learned from this, it's a lot of times better to have more than just one individual or one entity within a state, just because if that person leaves, then there's no continuity. And this is a type of program that definitely requires to have continuity of long-term process. It's really more of a longitudinal effort that we're all trying to go ahead and achieve here. So I can go on about that ad infinitum, but I'll go ahead and go to the next slide here. Again, what I'm wanting to do is just kind of bring you up as far as, if you weren't aware of this at all, what we had done basically with the 2012 portion of doing this one-time survey that we had out there was to go ahead and try and look at what we had for providers as far as their retention. And again, we were given funding for 2 years, and the issue that you have with that, or that we had with that and knew, is looking at ARRA-funded providers for a 2-year time period. We knew over half of them would still do an extension with their obligations, so there really wasn't any way to measure retention on over half of them in any way, shape, or form, and actually quite less of a number than that. So we went ahead and used the anticipated retention and working with the SHEP Center down there to develop a method. And some of the questions, again, Dr. Pathman has done this for 20 years, and he assured us and went over some of the data that you really can go ahead and look at the responses that people give, and it's a very good predictor of how long they plan to remain, even with the first survey or two that you're able to assess with them. Again, there is a report out there, all the states working together. Really appreciated everybody's effort on this and helping give input. There's something like a 75-page report that came out of this that is available. And if anybody's interested, and we can go ahead and link you to that. The next slide, please. What I want to kind of show you some of the things that we had learned in this, which probably didn't shock a lot of folks, but this was the kind of retention that we were seeing from National Health Service Corps providers with the 11 states that were involved at the time. And one of the things that I think most of us really know is that if you go ahead and you give somebody funding while they're in school, their chances of going out and being retained in the practice are much more difficult, usually because the scholarship program is going to go ahead and put people in, give them much fewer selections as when they go out and practice. So matching to a site that there's a really good fit for them is much more difficult. And this is why we tend to see less retention from scholarship versus loan repairs. And this gives us a really good example of what that retention is. And this follows very closely with a lot of the things that Dr. Pathman has done over the years. You can go to the next slide. I went ahead and highlighted, kept the National Health Service Corps loan repayment and scholarship ones there. They're kind of bolded to give you an example. So one of the things that we had done is to go beyond the ARRA funded providers and to also include different state programs. So some of the programs have their own, the National Health Service Corps state loan repayment program, or even their own individual state programs that are separate from the federal program. And it's just going to give you an idea there of, you can kind of see, again, the more that people are involved with those programs that are out there and can directly be working with folks, they're going to be much better at making the match and ensuring all the pieces kind of fit along that way. And I think that was one of the, the biggest things that, we've learned, again, which programs are better. And this is actually the first time that anybody had done something where it was a direct head-to-head comparison between the federal programs that were out there as well as the state loan repayment programs. Next slide. And again, if people have questions, please feel free to go ahead and interrupt. I'll try and make sure we get done. Yes.
Hey, Tom, it's Mark Overbeck. I raised my hand in the chat, but I'm not sure if that's working.
I can't see that, sorry.
Okay. I'll stop raising my hand then. That's good. I'll just interrupt like you asked. Mm-hmm. Could you go back to the last slide for a moment, that really cool graph?
Certainly.
I have a couple questions. One is it possible to get a copy of this presentation after the webinar? And I'm asking because in Oregon we're doing an analysis of our state-funded loan repayment programs, and this would be really great comparing to Alaska Sharp, California State Loan Repayment Program, Nebraska LRP, et cetera, and then HSC, of course. It would be great just to give to our contractor and let him take a look and see.
Oh,
but my real question is, the title of the figure is Anticipated Retention, and you've got 10 years out. I know that we're not 10 years out from ARA, so could you, like maybe just a 30-second version, describe, is there a particular methodology that's used, and how much of this is actual and then how much of this is anticipated?
It's all anticipated. The one thing though that we have is, again, working with Dr. Pathman down there at the Shep Center at the University of North Carolina, is that he's done these surveys, used some of these questions, and has been following up with National Health Service Corps providers over the years. So that was very, as he said, certain questions that you can ask as far as how long do you plan to stay at your location or stay within the state. Those things are very, very predictive and has over time done that. So that's kind of the quick snapshot. The other is that I want to get to here, and we just did in our webinar yesterday, was actually going ahead and using the alumni survey that we have, which is giving us the actual retention for those. So I think you'll find that as interesting. So great question. All right, go on to the next slide. And again, we will have the results from these slides that we can go ahead and give it to you, as well as other reports, the full report from that as well. So to kind of go ahead and do a little snapshot here, some of the things that we found as far as retention statements that were asked around the family fit in the community, where we were going ahead and seeing that there was a strong correlation to those who were going to planned on staying versus those that planned on leaving. These were the components out there that we found as far as the family fit in the community there. If they felt like there was a sense of belonging in the community, if their spouse or partner is happy in the community, and if their children are happy in the community. Again, these were, I'm just going ahead and going over some of the significant highlights that we had that basically showed that they were, I'm trying to think of the term, basically that there was a strong correlation there and statistically significant impact of this. Next slide, please. Other ones that we're asking about the service practices and their work site, the ones that again have a positive effect on retention, where the practice has an effective administrator, their work rarely encroaches upon their personal time, and then overall they were satisfied with their practice. Again, there's a bank of questions and responses, I should say, that they go ahead and check off as far as their whether they think this is a positive or negative, how well it kind of fits. And from that, we were able to go ahead and kind of tabulate that and really come back with these are the factors that are most important. And I don't think any of those were overly shocking, but again, we can show some direct correlation there with the anticipated retention, which again is a great marker for retention. And again, once we continue on with the alumni surveys and everything else, I think these things will strongly continue to show as well. Next slide, please. Then this one is going ahead and some of the things of where we were looking at, whereas a lot of states actually had gone ahead and did a really nice job that were part of the collaborative and were giving input to Dr. Pathman as far as going ahead and saying, we'd like to see the data analyzed this way, that way. And so these were some of the pieces, again, that were coming up that he was able to pull out from that. So higher retention being associated with serving in a state where somebody grew up. Again, significant differences serving in a state where one was trained. Those that are married versus being single. Non-Hispanic white versus minority. And then a rural health clinic and a prison. Those were sites that a higher retention was definitely associated with. Next slide. one of the areas where we were seeing lower retention was within the disciplines of nurse practitioners and physician assistants, as well as younger healthcare providers. And I think there's a correlation that we were seeing there with nurse practitioners, physician assistants being some of those that were in that younger age group. So the older somebody is, the more likely they're going to stay in one location. And that tends to happen a little bit more when it comes to physicians who are graduating at a little bit, more along the lines of between ages 28 to 30 in general. So next slide, and actually I'll have you skip that slide because I'm going to go over it a little bit further. Okay, thanks. One of the things I want to share with you quickly too is with the 2012 survey data. And I think this really kind of applies to everybody as far as trying to share with you what it is that we're kind of seeing with how people can use these reports that we have that are generated within the software program, is to go ahead and be able to take this information out to your different folks within your state, your FQHCs, rural health clinics, primary care association, and a variety of different groups out there, because you can pull the data by those different specific site practices as well as provider types, and be able to group that, ungroup that, share that with folks, and that's, again, very helpful. I think some of us that are smaller states and have smaller groups in each of those, we have to be kind of careful about again, the limitations that we can kind of use that with the analysis. But again, the longer we have data in the system, the more it grows, the better our reliability with that information and sharing that is. Also, I just kind of want to give some examples here. State workforce committee members, state recruiters, academic faculty, clinicians, state legislators. Next slide, please. Again, these are just folks that you can kind of share, we can share that with. We did go ahead and ask ourselves as states participating in this as far as the usefulness of the information, how valuable it was, trustworthy. I think one of the things we found too is, it wasn't controversial information, and when we were doing this, we were sharing it amongst all of us, and nobody seemed to really hesitate with wanting to go ahead and say, yes, it's okay to share my data. Doesn't make a lot of difference whether it looks like it's my retention rate's higher or lower than another state. There are usually reasons for that, and we want to be able to share that. Our whole purpose in this is not to go ahead and say, point out that I'm the best, you're the worst. It's to learn from one another and to really kind of beef up everybody's retention rate, depending on what the situations are. I think the last couple that we have in here as far as actionable information and using it is something where we're going to spend some more time trying to work with states to broaden maybe the partnership base that they have out there to make it more valuable within their states. Next slide, please. Again, I just put this in there so you can kind of have it. I'll let you read it later. And like I said, the slides will be shared, so you can go on to the next slide now. The Retention Collaborative here, I think one of the things we were going ahead and showing is that everybody agreed that it was a really good effort, and like I said, the states stayed on and continuing on, and like I said, we've added several states this year as well. Next slide. So what we've really been trying to do here is to build this longitudinal information system so that we can use it for years and even decades. I mean, really hope to get something going here, or I should say keeping it going actually now, and saying this is how it works, this is how you can use this tool in a variety of ways in different states, and then to come back to them and say, okay, great. You hope to be able to go ahead and take something that you can hand off and share within your state and keep it keep it going, because I think this will really help people go ahead and manage their programs, also being able to help individuals out there early on in their practice. Because this is something that even if you go ahead and we've had the information as far as trying to ask people after the fact, what were the issues, what caused you to not be retained. So asking these questions about their practice, the community, how their family fit, and all those while they're actually there and kind of new and in their starting of their service obligation, we really take out all of that bias from the response rates that you get by asking folks later. And again, this is based on this whole retention piece from practice sites. So just kind of give you an idea, I guess, as far as some of the surveying stuff that goes on out there. There's a first 3 months into the service, so there's a start of service, end of year, end of service, and then an alumni one that's out there. So kind of moving through these, again, you can go ahead and review these, but these are the components out there as far as what's being collected for those different ones as far as the programs themselves. And I'll have to go next slide. So early on, again, the first thing as far as this whole growth of data over time is to go ahead and look at the background, the family needs, the site match, and retention expectations. Next slide. And so what you'll see is in this, even if you miss a couple of these, some of the retention expectations, site satisfaction, and then they add the hours of patients, those will get picked up even if if you weren't able to get the survey there at the beginning of the program. As long as you get it there by before the end of the first year, you'll be able to collect that information. Next slide. Then the second year of the program, usually when they're finishing or their end of service is kind of there. Again, we have it set up so that if there are extensions on this, we can go ahead and it'll just continue to go with the end of year until they get to their end of contract in service. Next slide, please. And then again, after they're done, when they're ended with their service, you'll have the alumni survey. And one of the things that we have with that is we have all these different pieces in there as far as what's going on. We also have an administrator questionnaire as well. And the system enhancements of kind of going over this a little bit more quickly. These are the pieces that we've really done that have really added to our response rates and everything else. And this alumni report is in development. We just had a webinar yesterday with the states, and we're going over some of that. So the next slide here you'll see is actually it wasn't even listed as one of the reporting components, but we do have different reports that we can pull out of this, whether it's start of service, year and end of service, as well as the practice administrator reports. Next slide. And so we went ahead and pulled this quick report. Again, this is the alumni questionnaire data. This was just done yesterday. So these are new things that I really hadn't seen until yesterday as well. And if you go to the next slide here, this is where we're kind of getting into the components and pieces of where we're looking at the actual retention rate that we're seeing from the providers. That's really giving us some good information. Again, they have 6-month components out there that we're looking at over time here. So you'll see something in the range of those that are staying in Nebraska, a little over 70% at the end of 3 years beyond their obligation. And something around close to 90% 6 months after their obligation. There's a little blip where the curve goes up, but it's again, these are done at surveys on an annual basis, so there can be a little rise or increase, decrease in those as well. The next slide, please. these are some of the things as far as the questions where we're asking them to kind of assess as far as whether it met their expectations or not. And again, it looks like, definitely it's meeting expectations, and in most cases kind of exceeding their expectations. So I think that's really a huge piece, the positive response that we're getting from this. And it was interesting too, it done one of where he'd asked the same question earlier as far as at the end of their contract versus the alumni one. And they're more positive actually as time goes on, which I think is another interesting piece in this, but I won't go into that. The next slide, please. So again, the importance of this data collection and what we're doing, and we're just all trying to learn together, understand what's going on out there, want to share what we have, and try and get everybody to understand what the data is and how to use that retention information across states and across programs. And I'll go on to the next slide because I kind of we want to finish up here pretty quick. So some of the things that we're talking about with quality collaboratives and what we're trying to do is to go ahead, and we've really hit on most of these, I think, and doing really fairly well. Some of the things that we now have a little bit more sponsorship from the Foundation for Health Leadership and Innovation down there. We were able to secure some of the funds that they have for this to kind of continue on. And again, in order for a state to join right now, the price is like $1,500 a year. So it's a pretty meager cost there. And my final slide that I have on here, if you go to the next slide, is just that these are the states, that we have now. I think Montana, I believe, is going to be added back in here yet this year. So they were one of those states where the PCO director had left. We have a different PCO director out there and some of the staff. And I know it looks like they're going to be coming back in. But again, we're just kind of continuing to expand our capacity here to go ahead and assess and evaluate these things and respond to the retention issues. So hopefully we'll have an opportunity to go ahead and discuss this more at the PCO annual conference, and I'd like to be able to have a number of other people basically be on a panel up there to go over that as well. If there are other questions, I'd be happy to go ahead and answer those. I tried to move through this kind of quickly as I could, but again, happy to go ahead and share the reports that we have out there already, and to run anybody through this as well. Again, we continue to go ahead and make improvements and additions to this. For instance, going ahead and adding in the NPI provider numbers and things like that. I think the one thing to mention is that we have been getting support from the National Health Service Corps for all the states. They provide us all the National Health Service Corps providers and the community contacts, emails, and everything else on a quarterly basis, which is uploaded into the system to make this continuous process work and work well for us. I'll stop there then. And thank you.
Hi, this is Jean Finley from Alaska.
Hello.
Hi. You had two slides that had factors that were correlated with retention, and those were from the data from all the states in the Recruitment Collaborative. Is that correct?
Correct. That was a 2012 study. Mm-hmm.
Okay. Thanks. Just kind of averaging everything out.
Yeah, I know it's kind of difficult. Like I said, I think one of the things that we're really looking at is we do, and I know I'm going to try and put some more funding into it this next year here, but we really want to go ahead and add an additional report of where we can do. Right now you can look at all your data by state, and what we're wanting to be able to do is to go ahead and add it to where we can do comparisons amongst states again. We have the capacity to do that as far as from the data that we've collected, but we have to be able to have Dr. Pathman, the SHEP Center there, be able to prepare and kind of kick out that report. We have an estimated cost of about, I think, $25,000 to be able to make that happen. And hopefully we'll be able to do that before too long.
Interesting. It's good information.
Great.
We did analyze our own state data recently, and we have a couple of other factors that stood out. And one of them was, people living too far away from their families, which in Alaska probably would be a different factor. So.
Right, and we discussed that a little bit yesterday about adding some questions, whatever related to isolation. I think Dr. Pathman's going to be working with you on that, and add some other states. I know we have some isolated areas, but not nearly as isolated as they are in Alaska. I think that's creates a much bigger challenge for you. But hopefully this data, I think, does help speak to that, and to be able to address the differences we likely see within states, just like the comment about being able to grow your own and have training programs within your states are then much more likely to help with retention as well.
Yeah, there are a lot of similarities though too, so it's interesting.
Yeah, definitely.
Yeah, thank you.
Thank you. Any other questions, comments? Okay. Well, hopefully that was beneficial. And again, we can go ahead and share the information with you, as well as any links to the data and information. And if you're interested in knowing more about the project on the retention management system and joining that, again, happy to go ahead and give you the link to that. We have folks like Jackie Fennell down at the Foundation there for Health Leadership and Innovation who are happy to go ahead and do demonstrations as well. All right. Well, thank you.
Okay, so before we close, I would just like to open another opportunity for anyone if you have any questions or any open discussion about opportunities or best practices or challenges about provider recruitment and retention within your state.
Would you mind repeating that?
Just opening discussion about any opportunities or best practices or challenges about provider recruitment and retention within your state. Just an opportunity for questions or any open discussion.
To the facilitator, you're a bit hard to hear. It's a little bit muffled. I think that's why the other person was asking you to repeat yourself.
Okay.
Hi
everyone, this is Danielle at ASTHO. I'm just, before we close out the webinar today, just wanted to provide another opportunity if anyone has any final questions or if anyone wants to just kind of talk about any challenges they're facing in their states or anything that they want to share with other PCO directors and staff while you're all on the phone together. Just wanted to provide one more opportunity before we closed out the webinar today.
Yeah, I guess this is Mark in Oregon. Tom, the numbers are great, and I appreciate hearing more than I've known to date about the Retention Collaborative. Are there any estimates, conclusions about why retention is so high in some programs? Is it like in Nebraska, 90% is huge? Is that you're in direct communication with the providers throughout their obligation, or other states, they don't talk to the providers at all? Any sense of what has the numbers be better?
Yeah, I think some of the things that, again, how many of the providers that you have that are from within your own state, and again, where they train. Again, with the National Health Service Corps, we have a little less ability to go ahead and, make sure that we have a good match with the site and providers out there. So we think our, again, we're able to kind of show from most parts that our anticipated retention and everything else is likely going to be longer with our own state programs because we do that. But in general, I think with the National Health Service Corps, with the loan repayment program, it seems to be a pretty successful piece and match. I know one of the things that we do within our state is, just like I had a meeting this morning, is people that go ahead and apply for, loan repayment, even if it's our state program or the SLRP program, we do go ahead and work with some of those individuals and say, if you qualify for the National Health Service Corps program, you have a high enough HPSA score in a site, we want you to go that way. But I do think it's probably something of where you're right, a little bit more with the communication that we probably have with some of the providers out there.
Alcanza como que something more, porque Alcanza es un sitio que utiliza mucha gente para hacer esto mismo y para irse para el Army, qué sé yo, porque es mucho más fácil entrar porque nadie quiere ir. Alcanza en Nebraska. Y es raro ver porque el retention después que terminan de estos programas como que es como que en estados más veamos.
Was there anything else, Danielle?
I don't think so. Does anyone have any other questions before we close out for today? All right, then I just want to thank Mike and Tom so much for taking the time today to share all of this information with us. We will be sending out slides and a recording of the webinar to all participants afterwards, so be on the lookout for that, and also be on the lookout for invitations to more upcoming ASTHO-sponsored webinars. So thanks so much for your time, and have a great week, everyone.
Thank you.
Thank you.